Did you know that some nuts, when consumed regularly, can increase the risk of heart disease by almost 50%? These are not just numbers, but data from years of research. Such data is presented by the Journal of the American College of Cardiology. This especially concerns people over 60 years old, for whom the risk increases much more significantly. Many think that all nuts are equally healthy, but this is far from true. Some types, often found in our kitchens, can quietly harm health. These nuts can raise blood pressure, increase inflammation, and even accelerate brain aging, which is especially dangerous for the elderly. For example, one popular nut contains a compound that accumulates in the body over time and affects the liver, kidneys, and memory. Surprisingly, this very nut is often recommended in low-carb diets despite its potential harm. But don't rush to throw away all nuts. Among them are true superfoods, beneficial for the heart and brain. Let's figure out which nuts are worth eating and which are better to avoid in order to maintain health. Almonds are defenders of bones and the heart, ranking fourth on the list of the most beneficial nuts. Almonds are especially important for the elderly as they help maintain strong bones, preventing brittleness. A handful of almonds a day, about 20 pieces, provides a good portion of calcium and vitamin E to strengthen bones. Almonds contain magnesium, which helps calcium to be absorbed properly, strengthening bones rather than settling as a harmful layer. Monounsaturated fats in nuts reduce harmful cholesterol, which is very important for heart health. Research from Tufts University confirmed the brain protection from age-related changes thanks to almond antioxidants. The main thing is to choose nuts with the skin, where more beneficial substances are contained. It is important to chew nuts thoroughly, especially if you have swallowing problems, to get the maximum benefit. There is a nut that can harm the body. It will be described in detail later. Be sure to watch until the end. There is an unexpected product from the blacklist. Write in the comments which nut you eat most often, and don't forget to like. This will help the channel grow and bring more useful information. Walnuts are a true natural stimulant for the brain. They take third place in our ranking due to their shape, which resembles the human brain. The ancient Romans called walnuts the food of the gods for their ability to strengthen the mind and improve mental abilities. Modern science confirms that walnuts are rich in plant-based omega acids, especially alpha-linolenic acid, critically important for brain function. A study in an American journal showed that elderly people who ate about 30 walnuts daily for 2 months improved their thinking speed and mental flexibility. Unique compounds in walnuts penetrate the blood-brain barrier, protecting neurons from inflammation and supporting brain health. Buddhist monks have long used walnuts to maintain mental clarity and concentration in meditation and spiritual practices. Walnuts have traditionally been included in the diet as food for a clear mind, but that's not their only benefit. They are also a source of the important hormone melatonin. With age, melatonin production decreases, causing sleep problems. A handful of walnuts in the evening helps gently regulate the sleep cycle and improves rest quality. Walnuts are also good for the heart. They contain arginine, which improves vascular condition and supports heart function. It's best to store walnuts in the refrigerator to prevent valuable oils from oxidizing and to preserve their beneficial properties. The optimal portion is 9 halves per day. Shelling walnuts is a great exercise for the fingers, which supports fine motor skills and hand activity. Pistachios are true protectors of vision and heart health. Thanks to the ideal potassium to sodium ratio, they help control blood pressure. 50 grams of pistachios per day can lower systolic blood pressure by 5 points, an effect comparable to some medications but without side effects. These green nuts are champions in lutein and zeaxanthin content, which protect the retina from age-related changes. In Mediterranean culture, where pistachios are traditionally eaten, the rate of age-related blindness is significantly lower, confirming their benefits for vision. Pistachios are the perfect snack for elderly people. They are gentle on sensitive teeth, and shelling them helps control portion sizes. Research has shown that the sight of empty shells subconsciously reduces the amount of nuts eaten by about 1/3, helping to control appetite. For people with arthritis, Pistachios are available in partially open shells to ease the shelling process and enjoy a healthy snack. The optimal daily serving of pistachios is about 50 grams, providing a balance of benefits and calorie control. It is recommended to consume unsalted or lightly salted nuts to maintain health. Pistachios contain about 3 grams of fiber per serving, which helps regulate blood sugar levels. Sugar control is especially important for every fourth person over 65. That is why it is worth including pistachios in the diet regularly. Brazil nuts are a natural shield for the thyroid gland. They rank first among beneficial nuts due to their high selenium content. One Brazil nut contains almost 1.5 daily doses of selenium, a mineral critically important for normal thyroid function. Every fifth person over 65 experiences thyroid problems, often without noticing symptoms and attributing them to aging. Selenium from Brazil nuts acts as a natural catalyst, converting thyroid hormones into their active form, improving metabolism and mood. The ancient Incas called Brazil nuts the gift of the gods for their ability to boost strength and support overall health. The benefits of Brazil nuts are not limited to the thyroid. They contain unique fatty acids that support the myelin sheath of nerve fibers. With age, the myelin sheath thins, affecting coordination and reaction speed. 1 or 2 nuts a day help support the nervous system. It is best to store Brazil nuts in the refrigerator to preserve all valuable properties and freshness. Nuts in the shell last longer. The creamy texture and slightly sweet taste make Brazil nuts a pleasant and healthy addition to the daily diet. Peanuts are often considered a great substitute for unhealthy snacks. However, for the elderly, they pose a hidden threat as they are technically legumes, not nuts. Peanuts grow underground, making them especially vulnerable to mold and toxins. With age, the liver detoxifies less effectively, so toxins can accumulate. Studies show that substances in peanuts can increase inflammation, which is especially dangerous for the joints of older adults. They disrupt the balance of omega-3 and omega-6 acids. Peanuts interact with blood-thinning medications, creating additional health risks for the elderly. Commercial peanut butters often contain harmful additives. Peanut butter often contains hydrogenated oil, excess salt, and sugar, a real blow to the cardiovascular system, especially in the elderly. The process of roasting peanuts leads to the formation of acrylamide, a substance that accelerates cognitive decline, which is dangerous for the mental health of older adults. If you are used to peanuts, try replacing them a few days a week with safer nuts from our list. Your body will thank you. In traditional Chinese medicine, peanuts are considered a cooling food, which is not recommended for the elderly. Perhaps the ancient sages knew this, as confirmed by modern science. Professor Elsa Mortensen taught medieval history at the University of Copenhagen for 35 years. At 68, she was proud of her clear mind. Her story about how nuts helped restore health and confidence inspires those who care about their bodies in mature age. Elsa had a sharp mind and iron endurance until that fateful morning when she suddenly forgot the name of the king she had told about hundreds of times during a lecture. An awkward silence fell over the auditorium. Then a sharp whisper was heard. "Looks like Alzheimer's is knocking. The old woman has completely lost her mind." At first, Elsa thought it was fatigue, but memory lapses became more frequent. Elsa's thyroid gland enlarged. Tests showed a catastrophically low level of selenium. The doctor shrugged. Age-related. Colleagues stopped respecting her and began whispering behind her back. Young assistant Professor Sven openly mocked her trembling hands. The breaking point came when Elsa found a study on the effects of nuts on cognitive functions and decided to try them. Every morning, Elsa ate 2 Brazil nuts, tiny but powerful sources of selenium. In the evenings, she ate a handful of walnuts. Her sleep became deeper and her awakening clearer. But the real battle was still ahead. She couldn't relax. At the next meeting, when Sven started his biting comments, Elsa did not lose her composure. Instead of a trembling voice, a steel tone sounded, surprising everyone. "Before laughing at my memory, Mr. Jurgensen, check your facts. You confuse the reigns of Charles V and Philip II. The audience fell silent. The clarity of thought and iron logic of Professor Mortensen stunned everyone. The secret lay in the pistachios Elsa always carried to maintain her mind and health. The potassium from the pistachios lowered blood pressure, and lutein sharpened vision. Elsa literally saw the weak points in her opponent's arguments and easily refuted them. After 6 months, the University Council considered Elsa's early retirement. She presented a new study with such depth of analysis that it impressed even her enemies. The old fox became even more dangerous. Now there is a vase of walnuts in the faculty lounge, a tradition Elsa introduced to keep her colleagues' minds sharp. Sven Jurgensen, it is said, signed up to see Elsa's doctor. At the last seminar, he sarcastically remarked that nuts are food for squirrels, but Elsa just smiled. Squirrels, unlike some, know how to keep a clear mind. The whole hall laughed together, this time not at Elsa, but with her. Let's talk about cashews, hidden health risks after 60. These creamy nuts can become an unexpected problem for the elderly. Unlike true tree nuts, cashews contain almost twice as many carbohydrates, about 9 grams per a small handful. Cashews have little fiber and protective compounds. For every 4th person over 65 with diabetes, this poses a serious risk. Almost half of elderly people with diabetes face complications due to poor nutrition, and cashews can worsen the situation. In a pre-diabetic state, the carbohydrate load from cashews can be dangerous. Many consider cashews a healthy choice, leading to uncontrolled nut consumption. The shape of cashews creates an additional risk for the elderly. They rank 3rd in choking incidence among older adults due to their smooth, curved shape. The smooth surface of cashews can easily block the airways, especially in those who have difficulty swallowing. This is a serious danger for the elderly. Cashews contain oxalates, substances that bind calcium in the digestive tract. This reduces calcium absorption, which is important for preventing osteoporosis. Poor calcium absorption increases the risk of osteoporosis. Additionally, oxalates raise the likelihood of kidney stone formation, worsening health. Cashew processing raises concerns. To remove toxins, the nuts undergo intensive thermal treatment, are often roasted in oil, and heavily salted. Frying in oil and excess salt add harmful fats and sodium to the product, which negatively affects the heart and blood vessels. Cashews contain enzyme inhibitors that impair protein absorption. For elderly people with digestive problems, this creates additional difficulties. If you are used to cashews, it is worth considering alternatives. Walnuts or almonds provide a similar texture, but with fewer health risks. As ancient Roman doctors said, choosing the right foods is important for health and longevity. Replace cashews with healthier nuts. At 30, something beneficial may become harmful at 60. This is exactly the case with cashews and macadamias, which are tasty but dangerous for the elderly. Macadamias are creamy nuts from the Hawaiian Islands, a true luxury, but for people over 60, they can become a treacherous trap due to their high calorie content. One small handful of macadamias contains almost 200 calories more than other nuts. With age, metabolism slows down, and calories quickly turn into excess weight. The problem is not only weight. Macadamias have about 22 grams of fat per serving. For 15% of elderly people with gallstones, this can trigger an attack. The ancient Greeks called nuts the food of the gods, but macadamia is an exception. It has 3 times more saturated fats than almonds or hazelnuts, which is dangerous for the heart. Regular consumption of macadamias can raise bad cholesterol levels, especially dangerous for the elderly heart. It is important to remember this when choosing snacks. There are other problems as well. Hard kernels can damage crowns and weaken teeth of the elderly. The high price forces people to buy expired or rancid nuts. In salted and roasted form, macadamia turns into a real salt and fat bomb, which is even more harmful to the health of elderly people. Pine nuts, though small, can also be treacherous. Harmless-looking pignolia can cause serious problems when interacting with medications. Research shows that pine nuts interact with 60% of the drugs most commonly taken by elderly people, requiring caution. Combinations of pine nuts with medications pose particular dangers for elderly people. Those taking blood pressure drugs, statins, and some antidepressants are especially at risk. A study by the University of Bologna revealed that substances in pine nuts can weaken the effects of medications or enhance their side effects, which often goes unnoticed. Symptoms of such interactions are often attributed to age, without linking them to nut consumption. Roman doctors even advised the elderly to avoid small pine seeds. Modern science has confirmed these ancient observations. It is especially dangerous that the reaction to nuts may not appear immediately, but several days after consumption. This is a terrible ignorance, because doctors rarely warn patients about the interaction of pine nuts with medications, although it concerns every third person over 65. A significant effect is the pine nut syndrome, where a persistent metallic taste appears in the mouth, lasting for weeks in many people after consumption. It may seem trivial, but nearly half of those affected lose their appetite and lose weight rapidly. In the elderly, this effect is more pronounced due to age-related changes in taste receptors. Ancient Tibetan monks called pine nuts a deceptive gift of nature, aware of the hidden dangers associated with their consumption. These small seeds can bring not only benefits. Scientists have confirmed that the high content of polyunsaturated fats in pine nuts leads to rapid oxidation and increased inflammation in the body. For people with arthritis or other age-related inflammatory diseases, this is especially dangerous. The small size of the nuts creates another threat for the elderly. Pine nuts rank second in frequency of choking incidents among the elderly. The risk increases if a person takes medications that cause dry mouth, which is common for most people over 70. The main danger is related to the interaction of pine nuts with medications. They can reduce the effectiveness of blood pressure drugs, increase the side effects of statins, and disrupt the absorption of antidepressants. Studies have found that certain varieties of pine nuts can accelerate the development of age-related macular degeneration, the leading cause of blindness in the elderly. It is not necessary to completely give up nuts. After 65, one should make a more conscious choice, replacing pine nuts with almonds or hazelnuts to improve well-being. Replacing nuts can bring noticeable improvements within a few weeks. What nuts are present in your diet? Have you noticed any health changes when changing habits? Share your experience in the comments. Your story may help others make the right choice and improve their quality of life.